Okay. Thank you, everyone. In this lecture, we're focusing mainly on community mobilization and participation. How we can let the community to participate in any program of the public health. Community mobilization. How we can let the community feel that activity there is follow to him. This is the community mobilization, and let them to participate in that project or in that program. When the community participate in the program, that can let that program to be more success with the activities of the project. Yeah. Now let's see what does mean the community mobilization. Community mobilization means bring people together, like families, your friend, leaders, colleague, school, religious groups together to identify health problem and work together to solve that problem. This is the community mobilization. To let all members of the community to sit together and to look for the health problem. How we can solve that health problem. This is the meaning of the community mobilization. Additionally, let us to see the community participation. Community participation means to let every member in the community to participate in our negotiation or in our discussion or in our health problem to solve it. Yeah. Everyone can speak and reflect their ideas or insight. This is the call it participation. Why the community participation is important? As I mentioned, there is a many project or program has been conducted from the strategy or call it top bottom. The leaders there put the policy of the program, and this program they are going to fix it or to put it among the community. Sometimes it is not reliable or the community have an interest with that. But with the community mobilization, when we are going to design the project, like communicable disease prevention project, malaria project, onchocerciasis project, leishmania project, is very important to sit with the community and we hear from them and let them to feel this project it is belong to them. Yeah, by this can let this project to be more success. Yeah, that's why the community mobilization and community participation in health education or in public health is very important. Yeah. Now let us to go and to see in the next slide. In next slide is speak about or explain why the community mobilization work. The community mobilization work. This in this slide I mentioned some example. The health is not only about medicine or clinic. Health is also about the trust and culture, relation, and power. Imagine in the some village or some area, children keep the sick with the area. There is some children they have have the area, and government team come and build new toilet, but no one use it. Why? Because the community was not asked where to put it and how to maintain it or how can use it. Yeah. Now imagine the different approach. The same team meet the community leaders, community elders, mothers, youth, and teachers and leaders and ask them, what do you think about the cause of the diarrhea? What does mean the what the cause of the diarrhea? And what have you tried? And what would help and how you can help you? Together they design the toilet that fit their culture and budget and belief. The volunteers are trained to teach the volunteers the volunteers are trained to teach others. Local material are used and children make the posters. The chief speak at the community meeting. This is the example, two example. One first example, when the government team there came at the village without discussing, without speaking, they are fix it or they are did the toilet or built the toilet. But in the second example, they are sit with the community member in the meeting, youth, elders, women, child, youth, all of them they sit together and ask them what's the cause of the diarrhea. With their speaking, they realize the area come due to noble the latrines and also sanitation issue. That's why the cause the area. After that, they are discussed to control this area. It is better to build the toilet. When they are build them, they are use it and they know how can use that toilet and how can train their community to use it. Moreover, how can hygiene their hands, they give them like that. Yeah. This is the two different. In the first example, they not use the community mobilization or community participation during their designing or the build of the toilet. But in the second example, they are mobilize the community, let the community participate in the project. At the result, they are find that there is a big difference. In the first example, community even not use that service, but in the second approach, they use it, and also the health problem has been fixed. Yeah, this is why the community mobilization it is important. Now let us to go to next slide. In the next slide, here explain the step to community mobilization. If you need to move or to let the community to mobilize it, yeah, there is some step you have to use it as your public health professionals to mobilize community. Happen you have use this step. One of the step build relationship. One of the step build relationship with your community. To start listening them and meet the community leaders, elders, youth, to meet them, discuss with them what their health problem, learning from their history, know about their value and their consent. Don't rush to offer solution. Just you are firstly you have to build relationship. This is the step one. Step two, raise awareness. Explain them with use drama, use song, use story. Give them some workshop in the hygiene or in the prevention of the cholera or diarrhea like this. Yeah. Help the people to understand their health issue. teach them what the problem of the area come, explain them, to raise them awareness, to know what is their exactly health issues they suffer on it and how you can control it. Yeah. This is the second step of the community mobilization to raise awareness. The third step of the community mobilization, form core groups. People who can lead include youth and women and elder. Diversity matter. You have to do the core group. You can select your community or the group from the different part of the village or part of the area. Some of them elder, some of them young, women, different categories of the community. All of them, yeah. No neglect one and not discriminate any categories of the community. You can select one or two representatives from the whole community. Yeah. This is the third step to do the community mobilization. No excuse others. The fourth step, set goal together. Let the community decide what success look like. Maybe fewer sick children, maybe 100% toilet use, maybe training local health volunteers here. You can sit with them and explain them their health problem and discuss with them how we can handle. During the discussion, you can hearing from them. Some of them they are aware, can give you some solution, and you can summarize the solution. When they are decide the health problem, it is need like train the people or build the toilet or train the local health volunteers. You can do it like as you are discussing with them. The step five for the community mobilization, take action. Support community to act. You can support with your resource, you can support, you can give them the some ideas, you can sometimes you can support as organization can support with financial support, you can do it like that. Take action, support the community to act. Whether it's cleaning water source, starting mother group discussion, and also talking to the community government. This is the quality. Take action. Start to solve this kind of problem. And the sixth step for the community mobilization, celebrate with win. When you are implement the activities or succeed to overcome that issue, you can do the simple celebration. Yeah. Then ask them what's work and what did not work and how you can improve. Yeah. Yeah. This is a step of the community mobilization. How you can mobilize your community to do something. You can follow these six steps. One of them, first step, when you are go to new area, new village, new town, and you wanna to improve their health. First step, you can build relation with the community. Meet them, sit with the elders, team leaders, sit with them, know about their value, and know about their culture, understand them well. Secondly, raise awareness, explain them their health issue or their health problem. Yeah. This is the second step for the community participation. The third step, you can do you can do the groups. This group, no neglect any kind of teams. All of them, let them to be representative from the youth, from the elders, from the women, from the different tribes, different groups of people. Let them to be representative because when the community realize they have their representative in your group that can feel they can interest, yeah, no, they can feel they not being neglected, yeah, can accept this idea or this project, no resist, yeah, when you are include all kind of the groups, yeah, different type of the groups. The fourth step to do the success community mobilization, set the goal together. When you are visit like some area, example Niala or Khartoum or any area, you visit them. You can when you are as the public health professional, when you are see it and see like this, you can realize what is the problem this community they are suffering. Perhaps they can suffer from the they can suffer from the communicable disease or non-communicable disease. Yeah, when you are check it or realize what's the exactly problem this community they are suffer from it, just you can start it to aware to, to upgrade their awareness. Like example, if you nowadays people they suffer from the diarrhea and they suffer from the money disease. Yeah. When you realize this community they are suffer from the diarrhea, you can start to awareness them where the area comes and how you can control, how you can prevent them, the causes of this disease. Here. This is a call it upgrade the awareness of the 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 the, the teams. When you are upgrade the awareness, also you can do the as I mentioned. Additionally, in the five step, you can sit together in four step. Yeah, sit together our objective to stop or to control this the area by doing community awareness, provide the good water or sanitation waters, practice health hygiene like clean hand like this here. This is the goal. After that, can take the action, start to implement this project. Then, when you are success, you have to do simple celebration with the community. Yeah, this reason stopping of this diarrhea because you are sit together and also coordinate together and do these activities, this. Now the area is going. Then you can discuss more or can discuss further how you can to improve this plan. Yeah. This is a step for the community mobilization. Now let us to see the some successful stories around the world. The case one or example number one in Nepal. Nepal, this is the Asian countries. It is lies between the India and Chinese. Yeah. In the Nepal, reducing the there is a maternal death. Women and, during the pregnancy, there many of them their days, many women days. Yeah, they are put the plan training the local women, call it female community health volunteers. Then this community health volunteer visit any pregnant woman at the home. The third danger sign and also encourage the cleaning bears and based on this volunteers trust the neighbor and more women listening maternally. This is the quality the community participation. They select community or women from the community and train them to do give them awareness women in the pregnant lactated pregnant women and tell them you have if you need to delivery you have to go to clinic, there is the training midwife, there is the good service like that here, and all community there discuss it and do the mobilize then can then let the reduce the death of the women. Yeah, this is the one example taking place in Nepal. The second example in Brazil during the outbreak of dengue fever. In some Brazilian sites, community groups went door to doors. Also, their take from the community volunteers or from the community members, and train them how you can do to visit door to door to remove the mosquito breeding site. You know the like these Egypti or Culex, their breeding site, clean water in any side of the house. Yeah. These communities health workers they are visit home to home and destroy the mosquito site. This what
Mm.
they this what they did in Brasilia, and the case with their simple times they have been controlled that outbreak. Yeah, this because the community, all of communities participate this issue and do their best. The third example in Kenya, ending the female genital mutilation (FGM). In some Kenyan communities, elders, mothers, and youth come together to discuss about FGM. Even in Sudan also is taking place there. But the community, all of them, they sit together and discuss this issue. When they are discuss the health alteration, right, passage, celebration the girl without cutting her. After the times when the whole community sit together and find FGM it is not good, now they're free from, now their celebration the women or the girls without cutting. Yeah, this is some programs implementing in the different countries around the world. They use the techniques of the community participation, and they give you and will and success. Yeah, this all of project or all program has been success. Yeah, this is the third exam. This explain you why the community participation during the designing of the program is important. To let the community feel is the part of the to let the community feel he is the part of this program here by this year. This is the example or three example how the community participation is important in the implementation of the project. Now let us to see the some challenges how to overcome, how can solve. Yeah, during the community participation there is some challenges, some difficulties, how we can reduce this. Yeah, one of the challenges, people one of the challenges people do not care. Solution start small to find elder adapter. The people already try to make the change, celebrate them, and other will follow. Yeah, during the some time when you are bring the new innovation things, new projects, some member of the community they couldn't accept. Yeah. Having interest to do the change, and or sometimes some people they said the change is there is the more resistance. Yeah. In these things, when you are reflect your ideas or your project, there is some people they have an interest not engage with that project. Just you can focus with some those people early adapters, those people they they when their new things come they are they are doing adaptation earlier, like when the uh, when when let me to set when the new Facebook come or new smartphone, many people at the beginning having interest, but some of them, some small group, they interest here. This is the call it early adapters. Early adapters are just when you are do your program, you just care with early adapters, and these early adapters, they can go and reflect in their community. Simple, they can change the all of community. This is the one of the challenges facing you during the community participation or designing the program. Second challenge is leader dominant and others stay quiet. Use a small group discussion and the quiet people directly. Why do you think a rotate meeting location to everyone feel welcome? Yeah, sometimes also during some people, some leaders, they are more dictator. They not give the let me to set. They not give the example or not give the chance for their members. Yeah. In this issue, just you can ask the quiet people, those people they couldn't speak. What's your idea or what's your what do you think about this? Is it good or not good? Why? With this technique, can let you to understand them well. After that, you can see how you can handle this issue. This is the third challenges. Second challenges, third challenges. We do not have money or resource. Solution use what you have: time, creativity, local material, and volunteers to pouring. Yeah. Sometimes song or poster can cost nothing but can change everything. Yeah. Yeah. Sometimes during your implementing of your programs, you cannot have enough resource, but you can use the local materials. You can use your creativity to solve or to handle that issue. The fourth challenge is program int and so does not action. Build leadership from one day. Yeah. That means some project it is not sustainable. Yeah, some project it is not sustainable for this issue. Just you can train the people and build some leader from that community. Even if you're not there, that can let that project to be continuously. Yeah, this is our session today, or this is was last lecture of today. Now let us to do summarize what I realized. There are some people not come early. Just let me to do summarize. In this lecture, we are do talk about the community mobilization and community participation. And we said community mobilization means bring the people together in your community, like families, leader, school, young, all people can bring them together. All of them bring them together. This is the call it community mobilization. Community participation. That means can lead all these people. You are bring them together. Families, leaders, youth school, elder people can set their ideas, can decide to speak with the community participation in the health programs. Yeah, you gathering community mobilization. You gathering people in one place, different different people like youth, women, men, all of people sit together and discuss their health problems. Like your example, go to Khartoum or go to Niala or in Dalinji. You can sit with the community and discuss with their health problem. Now many people or many communities they are suffer from the diarrhea. Sit with them. Yeah, this is the call it community participation. You can hear it from them to tell them to tell them why they how can control AWG or diarrhea or how you can control cholera. You can discuss with them. This is the quality, community mobilization, all of them together, participation, all of them, anyone or any member can say his discussion. Secondly, also we are spoke about the community mobilization is very important and give the two example. One example at the some village, the government team come and build there the some village or the some area the cholera take place, but the team of the government they are come and build the toilet without participate with the people, without discuss with people, and live like that here. And second example, sit with them, discuss with them how to use. Laterly, they are discover in six. In second example, the community they already use that toilet and more mobilized, more familiar with that, and also health problem has been solved here. In third, also we are discussed about the step of the community mobilization. One of them build relationship. Second, build relationship with your community. Secondly, raise awareness. Then you can do the group from the different kind of the community. After that, you can set your goal. Then you can take action. Then you can do celebration. In last point, we are discuss some example or some story what the community participation is did in Nepal, reducing the maternal death in Brazil, fight the dengue fever in Kenya is the FGM, female mutilation female genital mutilation. Lastly, we will discuss about some challenges. One of them, people do not care. Secondly, leader dominate. And others take wide. The third, the money, their lack of the money or resource. Last one or last challenges, the program in does not and so does not action. Yeah. This was where did. Thank you for your attention or your